Hi everyone. In this video, we will learn how to calm a crying baby. Yes, a crying baby is very distressful for the baby as well as the parents. And if the baby is not able to be calmed, the parents get really distressed. And not only the parents, the neighbors, the grandparents, everybody. So it's so important to calm your crying baby. Now, it's also important for the baby because if the baby keeps on crying and nobody is there to calm the baby, it can affect the baby's development. However, crying is completely normal. Everybody cries, right? But it's important to calm the baby. And not only that, it's important to recognize whether the crying is normal or abnormal crying. Yes, and it's so important because if it's an abnormal cry, if the cry is because of a disease, then you need to show your baby to the doctor. So the first thing is you should understand the difference between a normal cry and abnormal cry. Babies usually cry normally every day because of multiple reasons, and that is because baby is hungry, baby is thirsty, baby is sleepy, or baby is discomforted by some irritable triggers, or baby's passed stool or urine and baby is now wet. And if the temperatures are very high, hot, or very low, cold, and baby is having some pain somewhere, then too many noises, too much light, bright light, too many visitors, and sometimes mother's food. And these are the usual causes of crying. What are the abnormal cries for which you may have to show the baby to the doctor. An abnormal cry is can be seen as one which is prolonged over a long duration of time, more than 20 minutes, and it is not consolable. You are not able to reduce the cry with holding or feeding the baby. That's an abnormal cry. In which case, you need to show to the doctor. Sorry for that. We have a power shortage. And it may be because of the pain, it may be because of some illness or raised intracranial pressure, or because of fractures, and a baby may be having some fracture, or baby may have some colicky pain or serious illnesses of intestine like intussusception. It may be a seizure even, or and baby may be having some insect bite or some painful rash. Maybe there is vomiting or loose stool because of that. Baby has pain in the stomach and maybe a rash in the butt, and urinary tract infection, cow's milk protein allergy, periodontal excoriation or rash. So the excessive cry you need to differentiate from the normal cry. And excessive cry may suggest that it's a serious illness and you need to show the doctor. In which case, the baby's cry may be lasting more than 20 minutes, or baby is inconsolable by holding or feeding. So baby may be considered to have an excessive cry. So it can be because of, yes, ear infection, brain infection, obstruction, intestinal infection, bone fracture, etc., etc., etc. So now, if it is a normal cry, then uh, you need to know how to calm the baby. So the first technique you should understand is that before the baby cries, the baby produces sounds like that means there is a possibility of crying. So start to calm the baby then itself, because it is more difficult to calm a severely crying baby. So prevention is better than cure. So start to feed the baby as soon as the baby shows signs of discomfort, like produces noises like or moves its limbs vigorously, or feed. So, so technique number two is to make the baby suck. So even if it is not for milk, the non-feed sucking calms the baby. So you can allow the baby to suck at the areola and the nipple, not only to feed the baby, but to calm and make the baby sleep. Even the baby can suckle at the grandmother or its own fingers if the mother is not available. But the fingers should be clean. If it is dirty, then wash the fingers and with soap and water before making the baby suck. Then avoid using pacifiers, feeding bottles, especially in tropical countries like India, Pakistan, Mexico, Africa, because in tropical countries, because of the heat and the humidity, a lot of infections are common. So if you use pacifiers and feeding bottle in this area, the babies can have serious infection. So the number two technique is sucking. So you can see a baby sucking at its own finger. So sucking and feeding, yes. So now you can feed the baby. So filling the stomach itself reduces crying. Now, if the nose is blocked while feeding, it may be difficult for the baby to feed, in which case you need to clear the nose block by sucking with your mouth or applying nasal saline drops. Now, you may be feeling a little uncomfortable by hearing the word sucking with your own mouth, but that's what our older generations used to do when the saline nasal drops were not available. Their mouths were clean and they used to just suck the nasal block from the baby's nose. And now since the nose block is cleared, the baby can suck the breast very good. Now, nasal block prevents proper sucking. So you need to open the nose and keep the baby warm, cover the hands and feet so that the nose does not get blocked. Now, if the baby is cold, the baby will have more nose block. Now, you can also make the baby, after feeding, take the baby on your shoulder and take the gas out. That's also important because too much gas in the stomach can cause pain, colicky, pain can lead to crying. So make the baby suck at your breast. That will fill up the stomach. So that comes to technique three, that is burping, which I already told you. The burping calms the baby. Now, if you have given feeding or the baby is having signs which shows that there is gas in the stomach, like nausea or hiccups, or the belly looks distended with dilated veins on the belly, then the baby may be cranky because of the gas. Now you can birth the gas by holding the baby against your shoulder or holding the baby upright on your hand in a sitting position and gently patting the back. Never don't close the mouth because the gas has to come out through the mouth. And in some older babies, like maybe when the baby reaches 1.5 months, it may be difficult for the baby to lie on your shoulder because of the gas in the intestine, which makes it difficult for the baby to bend over your shoulder. In that case, you can rock the baby slowly by holding the baby's buttock and under the baby's neck. You can just simply move the baby vertically up and down, rock the baby slowly so that the baby sleeps, and then you can gently bring the baby towards your shoulder. First, make the baby vertical, and baby may wake up. Then you need to again make the baby sleep with the rocking movement and gently bring the baby over your shoulder. Again, baby may wake up. Then you need to rock the baby back to sleep over your shoulder. This will help in removing the gap. Now, this is how you keep the baby on your shoulder. The baby's cheek has to be above your collarbone, and this position also is one of the positions to birth the baby. Now, technique number four is to hug the baby. Now, holding the baby against your chest or on your shoulder in skin to skin contact calms the baby. Now, you may need a dress which is open in front. The mothers may need, even fathers can do that, even grandparents can do that. They may need a dress which is open in the front from their neck to the feet so that the chest is exposed and the mother can hold the baby on her chest. She can either sit on the bed with two pillows to support her back, or she can take the baby on her chest and walk with the baby. This will also calm the crying baby. So this is called skin to skin contact. Now, technique number five is to move. Now, movement calms the baby. So when the baby was not born inside the mother, the baby was always moving when the mother walks, or the baby gets swaddled. I mean, the baby gets swayed inside the mother's uterus, or the baby may have a vertical movement like a rocking movement. So the movement calms the baby. So after getting delivered, also baby gets calmed by these movements. So walking the baby with the baby on your shoulder, on your chest in a skin contact manner, or swaying by using a cradle, or rocking the baby on your hand towards your shoulder can help in calming the baby. The first movement is to walk with the baby on your shoulder. Now, if it is a very small baby, say less than 3 to 5 months, it's always important to support the baby's neck. Because if you don't support the baby's neck, the baby's neck muscles can get injured because of jerky movement, because the baby cannot control the neck. And this can tear the muscles and cause small bleeding in the muscles. Sometimes they can get shortened and the baby's neck can turn to one side always. Now, so to you have to support the neck. Now, second movement is the swaying movement, which is a side to side movement. And traditionally in India, we use a cloth cradle, which is separated by a wooden bar, and you can use a small sheet so that the neck is not bent, and or you can bring all the cloth under the baby's neck so that the neck remains straight while the baby is in the cloth cradle. So it's important to keep the neck straight when you are using a cradle or cloth cradle even. Now, thirdly, the third position that we can use is rocking the baby, which I've already told you. That is, support the baby's buttock and the neck, and then gradually bring the baby, rock the baby to sleep, and bring the baby to the shoulder. This movement is very useful for a slightly older baby, like 1.5 months, 2.5 months babies, who may have gas in the intestine and they may have difficulty in lying forward over the shoulder initially. So now technique number 6 is to cover the baby with a swaddle cloth. Now swaddling, which is to cover the baby with a very large cloth uh, loosely around the baby, covering the hands and feet and the whole body of the baby like a mummy, prevents excessive movement of the limbs and clothes of the baby, and then calms the baby. Now, if the baby is not swaddled, the limbs are free to move, and the baby may have trouble in falling asleep. Now, however, if it is very hot, baby is sweating, and baby is feverish hot, then avoid swaddling. And swaddling can be done, especially if the climate is cold, if it's rainy, and the hands and feet of the baby are not warm to touch. So if you use your back of your hand to touch the baby's fingers, and if it is not cold, if it is not warm to touch, or if it is cold, then you can clearly swaddle the baby. So this is a picture showing a baby who is swaddled with a swaddling cloth. Now, technique number 7 is to soothe the baby. Now, you can use light, which is dim, or even no light if you are making the baby to sleep. You can use soothing sounds. The mother's voice itself can be soothing, maybe grandmother's voice also. The mother can hum a song, or you can use white noises such as the waves hitting at the beach or a raindrop sound, etc. These are all called white noises, which can calm the mind of the baby. Technique 8 is to avoid irritating your baby. Now, you may unknowingly irritate your baby by using bright lights. Switch off all the lights, especially after 7 p.m. in the evening or night. And avoid using loud music, loud metallic noise from kitchen. You know, kitchen utensils produce a lot of loud noise. You can close the door of the kitchen. Then avoid getting cold or hot and sweaty. Avoid mobile phones near your baby or use it in silent mode. That can avoid irritating your baby. Then technique 9 is to avoid inadvertent pain. Sometimes you may cause pain to the baby. You may not be knowing. When you press on areas where the skin is in close contact with the bone. So if that is the case, the skin will not get blood supply and the baby may feel pain. So if you press on bony prominences, such as on the chest wall, the ribs, or on the pubic area where a baby passes urine while holding the baby may have a pain and will cry. Sometimes insect bites or sharp ends inside the clothing material can also irritate the baby and cause the baby to cry. Technique number 10 is to distract from crying. So if very young, the baby can be distracted by moving from a dark area to a lighted area or from moving from a lighted area to a dark area to distract the baby. Then suddenly the baby will stop crying, or you can show the baby a toy or a book or an animal to a crow or a cow if you have one, or you can show in the TV, television, or computer, or you can show the baby some other person's face to distract from crying. And technique number 11 is to change hands. Now, if one parent becomes tired calming the baby, try changing the person. Why you are stressing yourself? Give the baby to another person of your family and let the person calm the baby. And the person usually should be a calm and relaxed person. It may be child's father or a grandparent. And so you can change the hands. And technique number 12 is the most important technique, that is to self-calm. The parent, the mother, the father, whoever is calming the baby, has to calm themselves. Only a calm person has the power to calm a crying baby. Now, if you are in stress, if you are crying, you will not have the power to calm the baby. And if you are stressed, you are less powerful. So therefore, become aware of your emotional state. If you are sad, fearful, tense, confused, angry, do pattern interruption. Now, what do I mean by pattern interruption? So if you become sad, you are more likely to become sadder. If you become fearful, you are more likely to become more fearful. If you are tense, you are more likely to become more tenseful. And if you are angry, you are more likely to become more angrier later. So you need to interrupt the pattern. That's called pattern interruption. So if you are feeling sad, then what you can do is you can hold your cheekbones and turn your head to sidewise and say kuchi kuchi kuchi. That will make you laugh. So that is called pattern interruption. You can hold your hands on both sides with clenched fist and move the fist like sideways and say to yourself that time for double happiness. That's the pattern interruption. Or you can listen to music in your Bluetooth and happy music so that it will keep you happy. Now, once you have done pattern interruption, you have to come to a calm, happy state. For that, you can imitate a calm person. Whoever you know as a calm person. If you are a Christian, you know Jesus is a calm person. Or if you are a Muslim, you can remember some prophet who is calm. Now you can breathe slowly like him, hum a song, show positive body language, and do positive self-talk. Now, positive body language is to keep your chin and shoulder slightly a raised position. And positive self-talk is to talk positively about the people, the things around you, about the situation around you, about yourself, about your baby positively. And you can repeat inside yourself to program your subconscious mind into happiness by saying to yourself 11 times at least whenever you feel tense, I love you, thank you, to yourself, to your baby, to anybody around you. So the technique number 12 is the most important technique, that is to calm yourself. So you can combine all these techniques. Maybe you can hold the baby on your shoulder, maybe skin to skin contact, walk with the baby, or do rocking or do swaying, and then sit. Once the baby is slept, you can sit them for some time in a chair before making the baby lay down on the bed. So, in short, congratulations for calming your baby and thank you for being such a good parent.